Hi, and welcome back to Pills and Bills. If you've ever been told, whatever you do, don't drink alcohol in this medication, you might know which drug we're reviewing today. Let's jump right into metronidazole, or Flagyl. It's an antimicrobial, specifically an antiprotozoal and an anaerobic antibiotic. Flagyl has a wide variety of uses, which include H. pylori, infectious diarrhea, sexually transmitted infections, and many other conditions that involve anaerobic bacteria. Trichomonas vaginalis is a protozoan STI that Flagyl is often used to treat. Trichomonas is what we would call a flagellated parasite. It moves using tiny whip-like tails that allow it to attach to mucosal surfaces and cause infection and inflammation. For our mechanism, metronidazole only becomes active in low oxygen environments. The medication contains a nitro group that is chemically reduced to damage the DNA of bacteria and parasites. When oxygen is present, that reduction can't happen. Therefore, Flagyl can only work on anaerobic bacteria to damage their DNA and cause cell death. Less bacterial cells means reduced and cleared infection. And next, we have our PharmaLink phrase. This is just a quick memory hook that your brain can latch onto to help better remember the brand generic pair. Flagyl is a molecule that's relatively small, lipophilic, and not highly protein bound. This means it penetrates the brain and cerebrospinal fluid very well. It can be used for certain rare CNS infections like anaerobic brain abscesses caused by Bacteroides or Clostridium. Given it can be used for many different types of infection, you can use the mnemonic bad cats to help you remember the most common ones. Metronidazole is available in a variety of dosage forms, including oral, IV, and topical. Oral is usually used for stable infections and outpatient treatment. IV is reserved for severe or systemic infections, and topical forms are commonly used for localized conditions like bacterial vaginosis or rosacea. Flagyl has a narrow spectrum. It only works against anaerobes and protozoa. Resistance to metronidazole is relatively low because its mechanism is pretty hard for bacteria to bypass. Moving to side effects, metallic taste may occur with Flagyl. This is because its metabolites are secreted into saliva, altering your taste receptors. Nausea and vomiting may occur due to GI irritation and central stimulation of nausea pathways, especially at higher doses. An important counseling point for patients so that they are not alarmed is that it may cause dark-colored urine. It's completely harmless. It's just because there are pigmented metabolites that get excreted into the urine. Looks alarming, but not dangerous. Moving to our warnings, avoiding alcohol use is a big one. This is mostly due to the risk of what's called a disulfiram-like reaction. When you drink alcohol while using this medication, it causes buildup of a molecule called acetaldehyde, which causes symptoms like flushing, nausea, vomiting, headache, and rapid heart rate. It can be very uncomfortable. Patients should avoid alcohol use during and for at least 48 hours after the use of Flagyl. Flagyl can also cause peripheral neuropathy with prolonged use or high doses. Less commonly, Flagyl can cause CNS effects like dizziness, confusion, or even seizures. It should be used carefully in patients with baseline neurologic disease. And that completes our review. See you next time.